with LGBT populations particularly, there's been very little research. More research is underway, but we are desperate for more. A lot of the conversation today and the conversation that we're having around LGBT persons and eating disorders is seeing what some of the differences are, seeing what some of the differences in nomenclature, the ways to approach recovery, to ways to consider particular elements about eating disorder presentation that might fly under the radar unless we ask particular questions. For example, with for a long time, persons who identify as lesbian have been left out of the conversation with eating disorders. There was an intra-community concept that lesbians were free from the female beauty mandate, free from the feminine ideal. When in reality, we know that eating disorders are biogenetically mediated mental illnesses. And so their bodies are also, frankly, they're not free from those same influences that influence the rest of, society. And so when a person who identifies as lesbian has feelings of stigma and shame, body image, size, weight, shape, appearance, there is sort of a two-pronged double down upon them, because inside their own community can be the concept that we should be free of the feminine ideal of what has been constructed. And then also, so the person actually has the feeling of body weight, shape, size, appearance, of stigma, of worry, of eating disorder, illness. How do they voice that within the community, their own community? They're being ostracized from multiple angles. And so we need to be able to identify and make sure that when we're assessing folks, that we're really looking into the whole picture of a person. There's also a fair amount of research that's being done now on the transgender community. We're learning now that it may very well be a very positive and effective strategy to begin hormone replacement work or endocrine, begin services of engaging endocrinology and beginning a transition process during inpatient treatment of an eating disorder. We would have thought before, okay, well, we'll treat these things separately. Sure, you may want to go through a transition process as a person who identifies as a transgendered individual, but let's fix the eating disorder first. Well, this year in the International Journal of Eating Disorders, there was a suggestion that actually, if we were to begin this treatment simultaneous with begin the work of endocrinology and begin the work of eating disorder treatment, if we simultaneously do that, then we're going to be able to have an outcome in which the person involved will thrive, and will be able to initiate recovery more quickly, and certainly more sustainably. And I'll admit, as a clinician, I was skeptical of this at first. And following the research, however, as such situations came before us, gave it a try with some incredible parents, and it's one of those times when it's okay to be wrong, because this child now is thriving because we followed the literature.